From diagnosis to long-term management, how rheumatology care actually works. One of the most difficult parts of rheumatology for patients is uncertainty. People often come with symptoms that have been present for months or even years. They have pain, they have stiffness, fatigue, but without a clear diagnosis or explanation. So I want to walk you through what a rheumatology assessment and care actually looks like from first assessment through to the longer-term management plan. So, a rheumatology assessment starts with detailed conversation between you and your clinician. We look at how symptoms began, how they behave over time, and what makes them better or worse, and how they can affect your daily life. The history is often very important than any single test. I also examine your joints, I examine your muscles and movement patterns carefully because inflammation, mechanical problems, and pain syndromes all behave different on examination. So we do blood tests and imaging because this helps us to support you and not replace the clinical judgment. Blood markers can help identify inflammation, autoimmune activity, but normal results do not always rule out disease, especially early on. Imaging is also important. Things like ultrasound or MRI can help in specific situations, particularly when we're trying to clarify whether inflammation is present or not. The key point is that tests are interpreted in context, not in isolation. In some cases, the diagnosis is clear early on. In others, symptoms may not yet fit neatly into a specific category. That doesn't mean nothing is wrong. It means the condition is still evolving. It could still be early evolving. In these situations, structured follow-up is essential. Monitoring over time often provides the clarity that a single appointment cannot be enough. Once we understand what's driving symptoms, we build a management plan tailored for you, the individual. This may include medication to control your inflammation or reduce your autoimmune activity that is overactive. And we might also offer pain-relieving strategies, joint injections where appropriate, and guidance around activity, pacing yourself, and flare management. The aim is not just symptom control, but preserving your function and quality of life. Many autoimmune rheumatic conditions are long-term, but that doesn't mean symptoms have to dominate your life. Regular follow-up allows us to adjust treatment, monitor response, side effects, and respond early to changes in flare. Management is a partnership, I often like to say. It evolves as symptoms and circumstances change. One concern patients often have is the idea of being stuck on management or medication forever. In reality, treatment is revealed continuously. The goal is always the lowest effective treatment adjusted over time as disease activity changes. Rheumatology care is not about rushing into a label. It's about understanding what's happening, monitoring carefully, and managing symptoms in a way that protects long-term health and function. Clarity, consistency, and partnership are at the heart of good care.